Hello, listeners. Welcome to MHT Conversations. This is Havisha, your host for today. And before I welcome our guest for today, uh, it's a new information for us as well as everyone who is listening to this. That along with Autism Awareness Month, it's also PMDD Awareness Month. And for the same, we have Miss Anuhya, who is the founder of BeyondBlood organization, about which we'll know more later on. But welcome, Miss Anuhya. How are you?
Hi, thank you. I'm good. How are you?
I'm good too. Thank you. Thank you for doing this. Thank you for agreeing to come on board with MHT and talking about PMDD, talking about menstrual mental health. That's what I think we are going to discuss today. So,
Yes.
Yeah.
It's actually, I could not pass upon this opportunity. It's a great platform to raise awareness on PMDD.
Yeah.
Thank you for having me.
Yes, we are very excited to know what is BeyondBlood and what is PMDD and how, probably mental health professionals along with professionals, who are there in your organization can come along and spread more awareness about this. Yeah. And let's see what we can do to make a change than what's
Absolutely.
Yes, definitely. So before we jump into the topic, I would like to introduce our speaker for today. So Miss Anuhya is a JRF Doctoral Fellow at Christ University, Bengaluru, who received her MSc in Health Economics from the University of York and a recipient of the Postgraduate York Gold Award 2019. She had a brief stint at the Center of Health Economics, York, before moving back to India. She is the founder of BeyondBlood, which is an organization that she had initiated, about which I would like that she introduces more to us. She also sits on the Youth Advisory Board and Patient Insight Panel with IAPMD USA and is the Joint Secretary at India Health Economics and Policy Association. Her current research focuses on medical gaslighting, benevolent sexism, and menstrual health seeking behavior of women and girls under the backdrop of the Indian health system. Some of her academic interests include heterodox perspectives, feminist economics, class, caste, gender, intersectionality in health, feminist and decolonizing methodologies. We are very lucky to have you on board with such a broad professional description. And so, as I mentioned, BeyondBlood is your organization, is your baby. So why don't you introduce your organization to us and to our listeners?
All right. So I started BeyondBlood around 2019. It was about 6 months or 7 months after I was diagnosed with PMDD. That was after I started my treatment and I was starting to feel better. And I just thought to myself, I had really great support system. I was diagnosed. I had money to afford the treatment.
Correct.
What about other people?
Yeah.
Like, even if you had the money and if you're not able to get diagnosed, or what if it's treatment's not accessible? And more often than not, it's always trivialized, right, when it comes to women's health.
Yeah.
So I figured if someone has to do something, it can be me. And that's how I started BeyondBlood. Initially, it was just a platform for a support group for people in India to come together and discuss and find ways to cope. Eventually, with a lot more people joining us, I registered the organization and we've been applying for grants because we need money, right, to do something. So that's how it started off. And we use an approach called the life cycle approach to deal with menstrual mental health. That is looking at it as a biological reality, going from menarche to menopause, identifying that at all different parts of life, there are different mental health needs.
Yeah.
That's about it, about BeyondBlood.
All right. That's wonderful to know, and we hope that the organization grows and it serves the purpose that you had started with. Yeah.
Absolutely. Thank you.
No problem. All right. So today's topic is menstrual mental health, and I would like to know from you what are your views in terms of how would you describe menstrual mental health?
I would think mental health is a broad spectrum. Like I said before, using life cycle approach, when we see from menarche to menopause, we have a lot of, I would say, cycles with menstruation and mental health. And a lot of studies show that there is a significant correlation between how people experience anxiety and depression and menstrual cycle as well. especially if somebody who has primary dysmenorrhea, which is period pain, their brain literally rewires because of the stress and pain they experience that is cyclical.
Correct.
And menopause as well comes with its own, mental health challenges, which includes, depression, stigma, hot flashes, a lot of changes. Same thing with pregnancy, during pregnancy and postpartum.
Yeah.
But what we're ignoring is that we are, you know, I think in a very capitalized society, we're forgetting that we are cyclical beings at the end of the day. And for that, we really need to focus on how the hormones, estrogen and progesterone, interact with neurotransmitters. It's really complicated, and there has been no research because no one cared about it before. And now research is growing, and we're understanding how complex um, the interactions are between these hormones and neurotransmitters. And studies have established that there is a clear dip in serotonin during premenstrual phase, whether you have PMDD or not, because of which you might feel, sad and hard to, have control over your effective emotions. So that whole idea is to just look at menstruation and its relation to mental health, not only through research, but also through significant life movement, pregnancy, menopause, menarche, all of these are significant life events. And these have a lot of impact on how our mental health and our mental well-being will have future trajectories as well. So this in broad is what menstruation and mental health is about. And within these are disorders that primarily affect menstruators. Let's say PCOS, which is an endocrine disorder. It has its relation to the menstrual cycle. And we know now that people with PCOS are more prone to depression, anxiety, body image issues, disordered eating. And same thing happens with people with endometriosis and PMDD. So when we're treating them, not only the current clinical focus is on fertility, we're forgetting and completely pushing away the mental health aspect of these disorders.
Correct.
And that's what we want to highlight.
Correct. I think when you say it reflects that, people only talk about the biological changes and not the, its effect on the mental health and how much,
Yes.
As you mentioned, so much of hormonal changes does go in your, body, and how you are adapting in terms of your behavior, in terms of your feelings, emotions. No one actually looks at that. And it's just
Absolutely.
discarded very nicely. Oh, you are, PMSing. Oh, you are this thing, just just looked at it as a stigma and nothing else,
Yes.
Not
there is stigma with there is stigma with menarche, there is stigma with menopause, there is stigma with pregnancy, whether you want to accept it or not, even though it's like seen as a joyous event. Like women who are pregnant are faced with multiple choices, and all these choices are again stigmatized. They're like, oh, you're not breastfeeding, oh, you're breastfeeding for too long. And these have real impact on mental health, and we sort of forgetting it. We need to bring it back together to see how it fits in and look at, I would say psycho-biosocial approach rather than just a biological approach to health.
Rather than just a biological approach. Very true. Yeah. So why the life cycle, approach? Why do you think that's necessary to look at?
Because I think, like I mentioned previously, these are all major life events. And, now we see girls are getting their menarche at a very, very early rate compared to what's happening, even though we don't realize. There's no statistical evidence right now to see how far along they are. But then, it's a huge change to experience. And even within that, we're sort of ignoring multitudes of identities. What about young girls with disabilities, intellectual or physical? How they respond to menarche. It has serious implications, and what kind of products they use. And the stigma, the trauma, there are instances where mothers have purposefully underfed their daughters and put them in malnutrition so that they do not reach menarche early.
Yeah.
It's an impact, it really determines how you move ahead for your entire life. And if you don't resolve the stigma that you experience during your menarche or the following years, how are you going to cope up with menopause? How are you going to cope up with any other disorders that come? What are your ideas about sex? Or what are your ideas about what is hygienic, as they call it? So all of these have a really huge impact. Like we forget how much stigma changes our behavior, whether it's health-seeking
Yeah.
behavior or even help-seeking behavior in terms of seeking out to other people. It
Yeah.
literally changes how we function, how we behave, and for that matter, we need to see how different people at different points of life have behaved. Like when we talk about psychology, for that matter, we look at development at
Yeah.
various stages.
Yeah.
So when we're looking at it, why are we ignoring the unique life cycle changes that menstruators go through?
Correct.
And we know now that a lot more people are entering surgical or chemical menopause. Are they coming with full informed consent? To where does all of this stand? So for that, it's really really important that we focus completely on a life cycle approach, see at what stage they are and what are their um, disorders, or what are their mental health problems, what exactly are they feeling. And it's all unique, right? Like you can't speak to somebody who's in menopause the same way you'd speak to somebody who's at menarche.
True.
And all of these mental health challenges, while it comes with age and experience, it also comes with hormones because of their interactions with neurotransmitters. So that's why life cycle approach is the way forward to look at women's mental health. It has implications even for addiction as well. So probably in few years we'd see this go up, because right now the research is happening, and it was happening in the early 1900s, but there was a sudden stop. Again, it's taking off right now, hoping that this would be a way forward for all mental health conditions.
Yeah. Yeah, that's very true. And I think you pointed out a very nice, comparison where we don't look at menarche as one of the developmental stages when we are studying developmental stages. That's very true. And we don't even look at menopause. It's like completely erased from the process. We just say, okay, women and men are, or any gender is just climbing the teenage state. That's all. But what's
Yes.
happening in that teenage stage, how early the menarche is starting, how late the menarche is starting, or how early the menopause is coming, or how late the menopause is coming, we are not seeing its effects on the development of the human being.
Yes.
Yeah.
We focus so much on body image, like
Yeah.
especially in teen years, we forget the body image that is pushed on you as you grow up, and the
Yeah.
pressure that both men and women
Yeah.
feel to look a certain way at certain age, to dress a certain way at certain age. It's real, and it's
Yeah.
getting more complicated each day,
True.
and the more we ignore it, the worse we are not going to be able to help our patients or clients if
Yeah.
we ignore all of these things.
Correct. Very true. Very true. And so much is stigmatized. Like I feel even now, I'm sharing like a very a personal experience I came across because I deal with students who are going in teenagers, and basically I have age group of starting from 5th grade to 10th grade, and so they are going to have menarche during that time. But when I'm talking to parents, and so I used to teach this one student, and she basically was not in a mood to study that day during our class. And I asked the reason why, what happened, and we're just having a conversation like that. And she's like, no, talk to my mama. So she didn't want to say that she was it was her first time when she experienced periods, and she wasn't comfortable talking about it. And that bothered me, because it was like, why can't she talk about it? What's so wrong in that? Or why the stigma around her that she can't openly say that, okay, I'm not in the mood because I got my periods, and because I'm scared this is the first time that I'm getting it, or whatever it was. So yes, definitely it's something that we need to talk about more. We need to spread awareness more. Definitely. So coming to the topic of this month's awareness, which is PMDD. So how would you describe what is PMDD?
So PMDD is essentially a cyclical mood-based disorder,
Hmm.
um, and it's directly related to menstrual cycle. All the symptoms of PMDD are experienced in luteal and late luteal phase in the menstrual cycle. PMDD was recently added to ICD,
Okay.
And was recognized by WHO in about, I think, 2019.
Okay.
Because of which now not only mental health professionals, but also gynecologists, endocrinologists, reproductive endocrinologists can also diagnose it.
Okay.
One of the reasons for this move forward is because when it came to PMS-like symptoms, and most women describe PMDD as severe PMS, they were approaching their gynecologist. And PMDD was in DSM from 3R till I think 5, and then introduced in ICD as well. So because it was only in DSM at that time, only a psychiatrist could diagnose it, and people were not approaching a psychiatrist because they were like PMS-like symptoms.
True.
So by adding it to ICD right now, gynecologists also can diagnose it, making it very legitimized, very accessible diagnosis. PMDD is often described as severe PMS. And I think that's the best way for people to understand it. But I think it's a little reductionist approach. You don't say migraine as severe headache, right?
Correct. Correct.
Yeah. So that's why I find that a little reductionist. What's happening in PMDD is that the brain at a cellular level is having a severe allergic reaction to the natural rise and fall in estrogen and progesterone that happens in the cycle. So the brain is unable to cope up with it, and it is not hormonal imbalance. A lot of people confuse it for hormonal imbalance, but it's not caused by hormonal imbalance. Studies have found that it could be genetic. Even brain imaging studies have shown that there's actually the way the brain lights up in the MRIs is completely different in people with PMDD during the luteal and late luteal phase versus people without it. Some of the symptoms that people experience are not just emotional experiences, but also like physical symptoms. In physical symptoms, breast tenderness, water retention, joint pains, cramping, and emotional symptoms, mostly rage, interpersonal conflict, irritability, and suicidal ideation. Suicidal ideation is the most prominent and debilitating symptom of PMDD. Whether it's active or passive, it's still debilitating. In fact, studies have shown that over 30% of people with PMDD try to commit an act of suicide. So it's really difficult because 30% is a huge statistic. And more often than not, because bipolar is a known disorder, people with PMDD are often misdiagnosed by bipolar because they feel better and they're happier in the follicular phase before ovulation. And then immediately after ovulation, they experience, depression sort of episode. So because of the manic and depression cyclical symptoms that are coming, more often than not, they are misdiagnosed by bipolar. And health outcomes of people who are misdiagnosed with bipolar are not good because it's completely a different disorder that has completely different treatment and medication. For that reason, we need PMDD awareness. We need mental health professionals to know, okay, this is what's happening. And this is probably a misdiagnosing. We have, especially in psychiatry, right? There's a thin difference between differential diagnoses.
True.
You don't know which one's where. So at least to have it right there for differential diagnosis, it could be. It gives patient a chance at better health outcomes. It gives the doctor a chance at helping out their client. Another thing with PMDD is it was very, very stigmatized when it first came out. A lot of feminists at that point of time felt that it was pathologizing female experience because, because of the cyclical changes, we are relating it to the menstrual cycle and you're essentially pathologizing the female experience. But we would argue that by recognizing PMDD, we are depathologizing the experience because we're saying it only happens to 1 in 20 people. That means the other 19 people we are not pathologizing. So we need to focus on right language in order to not stigmatize them because of how PMS jokes are everywhere. Like probably like we've joked with our friends, we've seen it in movies, we've joked with our partners, our families joke. So we just think that we're just trivializing PMS. And when we're trivializing PMS, we're indirectly or directly trivializing PMDD. And we lose a lot of people to PMDD, and it's still not acceptable.
Yeah.
Some of the studies show that over 90% of people worldwide are not diagnosed yet.
Okay.
And that's a huge number.
Yeah. Yeah, when you are mentioning signs and symptoms and all, I am reflecting what I go through before my cycle, and now I am also thinking whether do I should I look at the diagnosis criteria, should I probably fill out something and identify, because personally speaking, I do experience whatever you just mentioned, and it feels like a switch to my brain, like
Absolutely.
it's like a switch, and I'm just like, okay, but that was also a very real experience. That was not something just PMS. I sometimes really wonder that. And
Absolutely.
yeah.
So we call it as the light bulb symptom, not symptom, we call it the light bulb moment. It's like when you're hearing someone speak about PMDD and then a light just goes on in your head.
Yes,
Do I have
yes,
this?
yeah.
And that light bulb moment is something, that gives validation to the community, the PMDD community, because you're like, okay, someone's experiencing it, I've helped someone, like understand what it is. There is self diagnosis tool.
Okay.
You can go onto this website called www.iapmd.org, and then you can just do a self screen and see if you have PMDD or PME. And then you can approach doctors for a formal diagnosis as well.
All right. What other ways would you suggest are, basically a menstruator can keep a track of, or identify eventually that, okay, she needs to, or he needs to, like the menstruator needs to conduct, basically go and take help from a gynecologist, or, consult someone, basically.
So currently we do have a support directory where people can reach out to mental health professionals who are knowledgeable about PMDD, and we are looking to add more people on our support directory. But before we add any mental health professional, we do have a conversation with them to check their knowledge levels and check their credibility, because we want the best for the people who are accessing the support directory. And the best way to advocate for yourself is by tracking your symptoms and your cycle together.
Okay.
In most of the apps, you can track it, but there's also a specific app for PMDD. It's called Me versus PMDD. It's available both on iOS and Android.
Okay.
This is where you can track both your menstrual cycle as well as your prominent PMDD symptoms. One of the things we need to remember is that just like every other psychiatric condition, these symptoms are unique for you.
Okay.
Some experience completely different symptoms. Some experience only physical symptoms. Some experience only mental health symptoms. But as long as you're like the diagnostic criteria and your symptoms are matching, you would be ideally get a PMDD diagnosis and follow up with treatment.
All right, all right. When you were mentioning about apps, even one of the apps came to my mind as well, which is known as Mind Alcove. And I think that this app also will be very helpful in tracking your mood, because that's it's a mood disorder what we are talking about.
Yeah.
And having a mood tracker on your phone always will help you out. And it's not only a mood tracker, it has lots of journal options. So you can write down your day's thoughts, you can write down your week's thoughts, you have some certain prompts that can help you frame your thoughts. Okay, this is what I've experienced today, this is the reason my mood was XYZ. So it basically helps you track your mood, track your thoughts, and also have a community support inbuilt, which is anonymous, so that you can always share your experiences, take learnings from others. So I feel that that's also something. Technology is growing so fast that all of these uses are very helpful in us having a record of what we are feeling, what we are thinking. And with that, definitely, as you mentioned, we can always go and consult a mental health professional or a gynecologist and seek help.
Yes. It's interesting that you mentioned journaling aspect of this app, because a lot of people in the PMDD community use journaling as a way to put their thoughts out there, especially when there are intrusive thoughts. and you write them down, it leads to a moment of, catharsis.
Of
And
course.
that's a really nice way to deal with everyday functioning and everyday symptoms that you're experiencing. Journaling
Yes.
is in fact a great way to also vent.
Trend, definitely. I always prescribe journaling to my clients because so many thoughts keep on going in your head and you are so confused about it. But when you present it in front of you and they're right, there in front of you in your own handwriting, or say you have typed it out, it gives you a clear picture of what is going on in your
Yes,
brain.
yes,
Yeah,
absolutely. I'm old school. I just write it down because I
yeah,
just like it in front of me.
true, yeah. All right. So, you are conducting a lot of awareness campaigns through Beyond Blood also, and even before this month, it's an ongoing process. You had mentioned earlier. So, what do you think you have faced, as barriers when it came to awareness?
I would say definitely stigma.
Okay.
It's not just one layer, it's a twin stigma that I call, because you're talking about menstruation and you're talking about mental health, and breaking
Yeah.
these two really
Yeah.
stigmatized topic.
Yeah.
And around it, if you want, it's a gendered experience. It
Yeah.
is generally seen as a gendered experience, but it is a biological experience.
Correct.
But it is seen as a gendered experience, because of which there's even more stigma. There is
Yeah.
also medical sexism. So it's like these are like very nuanced layers
Layers.
that you
Yeah.
sort of have to deal with. And I have had professionals come up to me and say, I don't know what is PMDD. And that's great. There is no shame in admitting you don't know what it is.
Correct.
But again, after I speak about it, they will be like, can it be PMS?
Hmm.
Yes, it's a severe form of PMDD. It's just this inability, or like, I don't know, purposefully not understanding it, or
Yeah.
purposefully denying and devalidating the experiences of
Yeah.
people with PMDD. It's really like harsh sometimes. And I am a human being. As much as I want to be diplomatic as a founder of Beyond Blood, I do also have PMDD. So
Yeah.
it really hurts my feelings, I would say, when people say all sorts of things by
Yeah.
trivializing it. And they will also say stuff like, it's cultural experience. But PMS is seen as a cultural experience because, for only one reason, I'm not even kidding. So then people are calling PMDD and PMS cultural experience because they're like, in the US they crave chocolates and ice creams, and in Asia they usually go for something spicier as their cravings. I'm like, yes, all menstruators in their luteal phase experience cravings, and those cravings
Yeah.
are comfort food, which is again cultural. It's
True.
not that the PMS as an aspect is
Correct.
cultural,
Yeah.
it's that what they see as comfort food is cultural.
Correct. Correct. Yeah. Yeah. I think it
So
comes
it's like,
with, yeah, like as any other diagnosis, people are always in certain denial. No, I don't have depression. I'm just sad. Or I don't have panic disorder, I'm just anxious sometimes. It's this stigma of being labeled is, I think, is coming, when you mentioned that, okay, people don't want to accept that already this PMDD, it can be just PMS, because with just PMS you can get away with a lot of things. You are justifying it to yourself that it's just PMS. I'm fine. Like it's that you're not
yeah,
accepting what's the actual reality, and you're not seeking help for it. Whereas the
yes,
help is out there and it can make you feel better, just like any other diagnosis. I feel that way.
yeah. But right now, there is actually people who are like, I think I might have PMDD. I'm looking for a diagnosis, but my doctors have not heard of it.
Correct. Yeah.
And my doctors are denying this for me. And of course, there's not a lot of research, and there is currently a clinical trial going on a specific drug made for PMDD, which didn't do well, so it's not going to be released into the market. And currently, there are like 3 ways or 4 ways to deal with PMDD. And I think doctors are generally hesitant to prescribe medication because they're like, what if it's PMS and I'm just over medicating them? What if it is something else? And I don't know much about PMDD, and I do understand where doctors are coming from when they haven't learned about PMDD and they are hesitant to diagnose someone with PMDD. I totally understand their ethical side, but that's why we need more mental health professionals learning about it. So we are reaching out to various campuses across India, asking them to include uh, premenstrual disorders in their abnormal psychology syllabus, so that at least graduating students will know what it is.
Yeah.
Before they're out of the college.
Correct. True. All right. So I think that brings us towards the end of this conversation, and it was lovely knowing about the work you do, the kind of research-backed mindset you have, behind all of this awareness that's taking place. And so, any last message you want to give out to all the menstruators who are listening to this, or anyone who is basically in contact with a menstruator, as to how they can help or what change can they make?
I think you can definitely help by raising awareness, just talking about it to people, talking about it to your co-workers, or if you are a mental health professional or a doctor who's watching this, researching it. There are a lot of doctor resources that can help you learn about PMDD and help diagnose it. And if you are someone who's able to treat and diagnose PMDD, we'd be happy to have you on our support directory. And another way to destigmatize PMDD is to stand up and put a stop to the PMS jokes. No more trivializing. No more asking, "Are you on your period? Are you crazy?" So let's tone down on these, stereotypes of PMS. So we pave a path for people with both PMS and PMDD. There is no way to say that, this is bad and this is severe. These are individual experiences. And these are all self-reported symptoms. How we feel and what we experience is very, very valid. And these jokes should not should not even be, should be a thing of past. So standing up against these jokes will help destigmatizing PMS, therefore destigmatizing PMDD as well. And as menstruators, whether we have PMS or PMDD, we need to understand that there's a complex interactions with how our hormones behave with our neurotransmitters. If you're feeling a little low in your little phase, take a break, take a rest. There's no need to beat yourself about it. Just de-stressing in your little phase, paying a little more attention to your mental well-being will go a long way in self-care.
Of course. All right. Thank you so much for that, Anuhya, and thank you so much for coming on board, discussing about this. And we hope that more people start talking about it, more people stop making jokes, as we mentioned in the last, and they are basically doing a self-awareness. That okay, yes, I am going through this, and let's accept it as a reality, and let's take care of ourselves, just for the sake of that, nothing else. Yeah. All right. So all the information about BeyondBlood and about Anuhya will be attached to this video. Also, the information about the app which I talked about, MindAlco, will be attached to this video. Don't forget to like, share, and subscribe. And we hope to see you all soon. Bye-bye.
Bye.